From the hospital front line to the picket line, junior doctors taking the unprecedented step of an all-out strike to send a message to the British government, return to the negotiating table, or face the possibility of a national health service in crisis. The government wants to roll out a new contract for junior doctors in August to create a 7-day-a-week NHS. They say it will mean medical services will be just as comprehensive at the weekends as during the week. But the doctors say the contract is unsafe and doesn't reward them fairly.
The change to the working hours will have serious implications in terms of my family life and in terms of my work-life balance. From a financial point of view, it probably makes it unsustainable that I'll be able to continue looking after the women that I do as an obstetrician and gynecologist.
This contract really is discouraging current junior doctors in England from continuing to be junior doctors, and more importantly possibly, it's discouraging young people in Britain who are bright and motivated to coming into medicine, and it's really undermining the future of the NHS.
The junior doctors here say they have no choice but to strike. Despite months of negotiations, they say the government unfairly ended talks and that it wants to impose this new contract despite the consequences for patients and staff.
More than 100,000 operations and appointments have been cancelled because of the walkout. Critics say it puts people at risk, but according to doctors close to the negotiations, patient safety isn't being affected.
As a non-junior doctor myself, I can reassure patients that non-junior doctors, consultants, clinical fellows, staff grades, all of the doctors who are not junior doctors, who are not in training, will be covering the junior doctors, and patient safety will absolutely not be compromised. As a profession, we collectively have never compromised patient safety, and we will never compromise patient safety.
UK Health Minister Jeremy Hunt says the strike marks a bleak day for health services in England.
The choice is not to do what has never happened before, which is to withdraw emergency care. And let me stress how hard the government has worked to try and get an agreement. We've been trying for 3 years now to deliver our promise of a 7-day NHS.
But with both sides at an impasse, that plan may be a long way off. Stancl, Al Jazeera, London.